It's no secret that doctors work long hours and don't always get a lot of time off, but do we really work 25 hours a day, 8 days out of the week, like the stereotype would suggest? Let's get into it. What's up, everyone? Mike Muellner here. I'm an internal medicine doctor from Los Angeles, California, and I currently work as a hospitalist. So that's a type of doctor who works exclusively in the hospital setting. Instead of a clinic, we work only in the hospital, dealing with patients who are sick enough to require a stay in the hospital. And let me tell you, this topic is very fresh on my mind because I just got done working 7 days in a row, an average of 12-hour shifts per day. And so if you do the math, right, that's 12 hours, 12 times 7, 14. So that's 84 hours in a week. So that's about double what's typically considered a full-time workload of 40 hours. And it seems like a lot, right? But don't worry about me too much because I actually have the next 7 days off. So this is a very common schedule for doctors, especially those who specialize working in the hospital setting, is we work 7 days in a row and then we get the next 7 days off. We call it 7 on, 7 off. And this is really popular because it allows for very good continuity of care. So on day one, I'll get my list of patients that I'll be seeing, and then I get to see them every single day for the whole week. And that's really good because for many patients, when they come to the hospital, I might be the only doctor that they'll see throughout their stay. And so that allows me to develop a very good relationship with not only the patient, but also their families, and also helps me to get to know their medical conditions really, really well. Many patients who end up in the hospital have very complicated disease courses. They might have cancer. Maybe they've been in the hospital several times in the last couple months with various different things, infections, blood clots, all kinds of stuff. And it takes hours to really get a handle of all that, to learn that really well enough to be able to make well-informed medical decisions. And if you were to switch every single day, switch doctors every day, these are all these new cases you'd have to learn. It would be very hard to get a good understanding of everything that's going on. And also you wouldn't be able to develop that relationship with patients and their families. So for this reason, continuity of care is really important, and working the 7 days in a row really helps to allow for that. Another benefit is you minimize the handoff. So handoff is when one doctor signs out the care of patients to another doctor who's taking over. And this is sometimes when medical mistakes can happen, right? You can hand off a patient and say, oh, this patient is on antibiotics for an infection. But then the person you're giving sign out to might think, oh, wait a minute. So this patient, you said they're not on antibiotics, no problem, no infection. Okay, sounds great. There's a miscommunication that can happen anytime you transfer care from one provider to another. Now, we have a lot of mechanisms in play to help prevent that from happening. There's a medical record. All medical decisions are documented in the record. So even if there's some kind of a miscommunication in handoff, there's other documentation to show what's been done. But still, there's always the potential for mistakes. And so by working 7 days in a row, as opposed to just like 3 or 4 days, you really minimize the handoffs that occur and make it less likely for these sorts of mistakes to happen. But the flip side is that it's a lot of work. Working 7 on. Yeah, I mean, I feel pretty tired right now, after just finishing my week. But luckily, when you get the next few days, or actually 7 days off, that's plenty of time to recover. And some doctors, myself included, we even prefer this schedule to the more kind of typical 5-day work week, because with 7 days off, that's actually enough time to go do a little bit of traveling. You can leave town, hang out with friends and family, and it really allows time to recover from the work week. And I know my colleagues who have families with kids, it's pretty cool. During their time off, it's like they can be basically stay-at-home parents. I know one of my colleagues will do things like he'll volunteer to go on field trips with his kids, and that's really great stuff for a full-time doctor to be able to have that side of that lifestyle as well. I think is a plus. And so, we do work really hard when we're on, but then with the time off, it's something that's quite manageable. And actually, when I think about it, really, and technically, I guess I'm only working half the year, right? If you do every other week you're on the job, it's half the year. So I don't really think it's a whole lot to complain about. Now, every doctor is different, especially the different specialties. So I can't really speak for all physicians. I can think back when I was in medical school, it seemed like the surgical rotations, those shifts seemed to be particularly grueling. I can remember even doing a few 24-hour calls back on my surgery rotations. And so I think there's a lot of part of it is with surgery, these are doctors who spend much of the day in the operating room, but that's not all. I mean, they're not just operating on patients. They also have to follow up on patients that have had surgery on previous days. They also do clinic consultations. So there's many different hats that a surgical specialist would wear. And I think because of that, the days tend to start earlier. If you're a surgeon, you show up at work not at 8 a.m., more likely 6 a.m. or even earlier because you have to round on the patients that were operated on previously before spending most of the day in the operating room. And so it really does vary as far as what the workload will be like based on the specialty. And so I think there is a lot of truth to this. You know, you see it on Grey's Anatomy, doctors working all the time, they're exhausted, half asleep. We hear these stories about physicians falling asleep in the elevator at the end of the day. And maybe there's some truth to that, but we do certainly get time off to recover. Okay, so now let's get into an obvious question. Whoa, if a doctor is so tired that he or she is going to fall asleep on the elevator, if a doctor's working 16 hours, is this person really going to be in the right frame of mind to take care of people, especially at the end of shifts? And so that's a concern, especially among resident physicians. Historically speaking, residents would tend to work the most grueling of shifts and hours. I remember, 80-hour work weeks were fairly commonplace in residency. And unlike now as a staff physician, when I was a resident, I didn't have that week off afterwards. And so really maintaining or finding ways to avoid extreme fatigue is important. And so for this reason, a lot of hospitals do have limits on as far as how many hours you can work in a row. And if you work a certain number of hours, then you have to have the next day off. And a lot of that is for patient safety because you don't want someone half asleep operating on you, right? Or making medical decisions. And so there are safeguards in place to try to prevent people from being excessively fatigued in the workplace. And so in summary, while the medical profession does lend itself towards putting in a lot of hours, there are ways to compensate for this. And at least in my specialty, hospital medicine, the way we do it is we'll do the 1 week where there's a whole lot of hours, over 80-hour work week, but then get the next week off afterwards. So it's not at all unreasonable. And looking back on it, if I could do this all over again, I think I would still go into medicine. I would still pick the same specialty. I hope you enjoyed this video. Here's another video you can check out here. If you like medical related or healthcare related content, go ahead and hit the subscribe button there. And I'll see you guys next time.